Welcome to the press conference on this year's HKDSE examination. In a moment, Mr. Kevin Yeung, Secretary for Education, will say a few words, and then Mrs. Hong Chen-Choi-Wah, Deputy Secretary for Education, and Professor Wei Xiangdong, General Secretary of HKDSE, will speak, and then we'll have a Q&A session afterwards. I give the floor to Mr. Yeung. Thank you. Friends from the media, good afternoon. Together with the HKDSE, we would like to announce the arrangements for this year's HKDSE examination, including the start of the examination, a special examination venue, and other arrangements. In the past 2 weeks, the HKDSE and the Education Bureau and the Center for Health Protection and the school sector have maintained very close liaison to follow up on the latest development of the epidemic. We've also stepped up our preparation work, including enhancing protection measures and procurement of anti-epidemic supplies. With the support of the central government and with the concerted efforts of government departments, different sectors of the community, as well as members of the public, we see that the epidemic has eased and that the government has been distributing anti-epidemic services back to everyone in Hong Kong, with RAT kits included. Within a very short period of time, this will help us to find out the remaining silent carriers for follow-up so that we can further keep the epidemic under control. Social distancing measures can be expected to be lifted in phases starting from the 21st of April. And after the Easter vacation, schools will start to resume classes, and face-to-face classes may be orderly and may be resumed in an orderly and phased manner. Meanwhile, we have also consulted the school sector on the HKDSE examination. While schools have reflected their concern for health risk, they have also said that most candidates would like to see the examination implemented, and so long as we ensure the protective measures in place, then the examination can be carried out safely. So we have decided to start the exam on the 22nd of April as scheduled, and under our compressed timetable, 60% of the candidates will be able to complete all subjects in the first 2 weeks, and the examination period will end on the 14th of May, and the practical examination for physical education subjects and music subjects will be held in late May or early June. The date for announcement of results will still be the 20th of July, and we believe this will not disrupt the application schedule for local and overseas universities. Our prime target is to administer the examination smoothly. The Omicron variant is highly transmissible and sometimes asymptomatic. So the consensus between the EDB and HKDSE to make all efforts to safeguard the health and safety of hundreds of candidates and invigilating staff in examination sites. The EDB has already provided $20 million in extra to procure RAT kits for all candidates and invigilating staff on every examination day, and to enhance the online marking system of HKDSE so that markers can choose to log in to the system for marking to reduce the risk of cross-infection caused by markers having to travel to marking centers. Very stringent anti-epidemic measures can better protect everyone in school examination venues. We ask candidates to cooperate. Please do not engage in irresponsible acts such as making false declaration or attending an exam venue even though tested positive, with no regard for the health of other candidates and invigilating staff. Mr. Professor Wei from HKDSE will elaborate on the enhanced protective measures in school examination venues and candidates. As for those affected by candidates, we have already said that without compromising the community's anti-epidemic efforts, we are willing to explore the possibility of allowing confirmed cases or close contacts of confirmed cases to take part in the examination in special examination sites. We understand candidates' aspirations to join the examination, but no such arrangement should jeopardize the health of other candidates and invigorating staff, upset our quarantine and isolation facility priorities, and we must avoid risk of infection. Having discussed with government departments and with their support and cooperation, we have the following measures. First, when there is an R&T declaration exercise in the residential address of candidates, they can be given priority in testing so that they can get the results early and attend an examination in the morning. Now, we are going to set up a special examination site at Penny's Bay's community in isolation facilities for non-confirmed candidates, but who have to be under quarantine. Furthermore, confirmed cases can choose to take the examination at PBCIF if the health conditions permit. We will foot the bill for the extra cost for setting up that venue, and later on our permanent secretary will elaborate. I'd like to remind all candidates, in the long run, your health is more important than taking one examination, and your ill health can also affect your performance. All confirmed candidates should consider using the HKDSE's assessment system to replace an actual examination. Now, Omicron is a highly transmissible variant. Although symptoms may vary from persons to persons, I urge you not to take it lightly. We must all work together and observe all preventive measures, observe social distancing measures, and be fully vaccinated to safeguard the health of everyone, and also that we can carry out the DSE examination smoothly so the candidates can give full play to their competence. Now, there may be unforeseen situation, and will closely monitor the development of the epidemic, and when there is any emergency that is unforeseen affecting the examination, we will make an announcement as soon as possible. And with the concerted efforts of the school sector, I'm sure we can prevail. Now, candidates, in the past few years, you've been affected by the epidemic, and classes have been disrupted, and there are many uncertainties. I'm sure you will feel rather uneasy. The exam will start very soon. I hope that you can leave aside your uneasiness and focus on making preparation for the examination and cherish the support we have for you to overcome this challenge. There are bound to be ups and downs and challenges in life. So long as we stay positive and with perseverance, we overcome difficulties. I'm sure we'll see better days. May I wish that all candidates can safely and smoothly complete the examinations. Lastly, may I appeal to enterprises and members of the public for the first 2 weeks of the examination, i.e. the 22nd of April to the 8th of May, please avoid traveling during the peak hours, i.e. 6:30 to 8 p.m. in the morning, so that candidates can travel smoothly and to their examination venues. I hope that MTRCL and franchise bus companies can increase headways during the examination period so that candidates can reach their venues smoothly. I now give the floor to Mrs. Hong to elaborate on the arrangements.
Mrs. Hong, thank you, Secretary. Friends of the media, the Secretary mentioned that the epidemic is easing, and we will provide special exam arrangements for candidates. Before explaining the details, I hope that you understand the Omicron is a very transmissible virus carrying inconspicuous symptoms. So from anti-epidemic angle, we must distinguish between the confirmed cases in close contacts to avoid cross-infections. They cannot go to the school exam centers to safeguard the health and safety of the many candidates and exam staff there. We must also avoid having the confirmed cases in close contacts traveling on public transport and increasing risk as the result and even becoming a source of infection clusters. So based on these principles, we are now making arrangements on 3 sides for the close contacts and the confirmed cases. First, like last year, if the candidates are under RTD, they will be given priority in testing so that they can get the PCR test results as early as possible to decide whether they can actually join the morning exam session. Now, the complicated thing this year is that RTD exercises are being worked on by different departments and private testing contractors. So we have to strengthen communication with the relevant units to avoid any misunderstanding. Now, basically, all parties are in support of this measure. Second, again, we will set up a special exam center at the Penny Bay Community Infection Center for students who are not infected but are close contacts, i.e., their family members have been infected but they test negative. But these students may be infected in a short time because of the infection of their family members. So we are suggesting that these candidates liaise with the HKDSE to tell us that they are willing to be quarantined at the PBCIF, and then we will arrange for point-to-point ride on anti-epidemic taxis for them so that they can be quarantined and take the exams there. The third measure is that we will take an extra step today, and this is to allow the confirmed cases who are willing to be quarantined and sit for exams at Penny's Bay to take the exam, and where their health conditions permit. So we'll provide point-to-point ride for them to go to Penny's Bay to be accommodated and take exams. We understand that confirmed cases, health conditions vary from day to day. So we suggest that we would allow the candidates to opt for exam or not on the day of the exam. Now, they may go to PB, but then they can ultimately choose not to take the exam. But for fairness purpose, once an option is made, the candidates cannot change his mind. So that is not allowed. Now, at the PBCIF, there will be different zones. So from taking in the candidates in terms of the accommodation and exam units, the confirmed cases and the close contacts will be separated. And similarly, the exam staff and staff will also be separated to avoid cross-infections. But what is difficult for us is we cannot predict the number of students who have to take the exam at PBCIF, because we're talking about two types of students, the confirmed cases and the close contacts. And then these people have to, again, show whether they are willing to join it. So there are a lot of variables. And this year, we are also allowing those who test positive on the day of the exam to take the exam. So we will allow them to go to Penny's Bay as well. The goal is that students who have the need and are willing to take the exam in the isolation facilities can to take the exams there. So our plan is to start taking in the students in mid-April, but you have to understand that if you have to take the exam on the day when you test positive, the timetable is very tight. So before the exam time, there is a designated period where a designated hotline is there to where the students can call and say that they are going to take the exam at Penny's Bay. And then we'll also arrange for an anti-epidemic taxi to take the candidates point-to-point to Penny's Bay. So we hope that they can arrive before 8:30 in the morning. But if you don't need to actually go on the day of the exam to Penny's Bay, we have another hotline. And then we hope that the candidates should not abuse the same-day hotline to cause delays for those who have the real need. So we have different arrangements in place. So I am appealing to the confirmed cases and close contacts. Do not cover up. Do not gate crash the exam venues in the schools to avoid infecting your teachers and students. Now, a lot of arrangements are necessary, and many government departments are involved. We are now enhancing the arrangements, and different government departments and sectors are involved. Well, this is going to be a very complicated exercise, and we need more time to iron out the details. So this, I'm announcing the broad framework today. I hope that you appreciate that later on, when all the details have been mapped out, we will make an announcement this week. I hope that candidates can rest assured a lot of people are willing to help you. When you are willing and where your health conditions permit, you can take the exam. Now, there have been a lot of rumors online, so please don't believe in those rumors. Stay focused in your studies. And of course, candidates and parents have to think carefully if their health is not that good, or whether they should be opting for taking the exam or opting for result assessment. Now, for the two past DSEs, the highest level to be obtained at result assessment has been changed from level 4 to 5. Now, people say that Omicron only carries mild symptoms, but the symptoms vary from person to person. Some people are very tired, feel lethargic, and they keep coughing and have a extremely painful throat. So you may be under psychological and physical pressure. Would you be able to achieve your desired results? That's the question. Now, for the special exam center at Penny's Bay, well, it is a result of efforts of many government departments. I would like to thank all the various government departments for their assistance. And another important part of this arrangement is we need a large number of exam staff. For now, we don't know how many students would need to opt for this arrangement. We think that we need a large number of invigilators, so I appeal to those in the sector, including those who support the government setting up special exam centers, to volunteer yourself as a exam staff at Penny's Bay. We will provide full PPE for you, and we will provide anti-epidemic training to safeguard your safety. I believe that if we work concertedly, I'm sure we can set up this exam center. So I'd like to remind candidates that please watch out for your own physical conditions. If 1 or 2 days before the exam you think you are feeling unwell, you are very tired, you have a sore throat, a fever, you don't have to wait. You can use the RAT kits at your home or given to you by the HKDSE to do a test. And if you post positive, then you can actually consider whether you should go to take the exam at Penny's Bay. So that's all I want to say. Thank you.
Thank you, Mrs. Hong. Well, as said by the Secretary, in light of the latest development of the epidemic, after consulting the EDB, the health experts, and also the school community, the HKEA has decided to commence the HKDSE as scheduled on the 22nd of April to ensure that the exams can be carried out smoothly. The secondary schools will only resume face-to-face classes after the exam for the core subjects have been held. This will lower the risk of infection and will make it easier for schools to arrange for examination staff. As said, there will be enhanced anti-epidemic measures. There will be a measuring of body temperature, the wearing of masks, and also health declaration by candidates, and hands should be sanitized. And we have a very important element this year. All candidates and examination staff members have to do an RAT before going into an exam venue, except by Mrs. Hong, that can prevent the other candidates and also exam staff being affected, to avoid the need for students to remove their masks. For verification of student ID, we will ask schools to do that outdoors in an open area so as to lower the risk of infection. As for arrangement inside an exam venue, we'll ask schools to arrange for more classrooms and special rooms to be used as examination sites to separate students and to prevent the possibility of cross-infection. And the spacing between examination desks should be wider, and all windows and doors should be opened during examination to ensure good ventilation. According to announcement by the government or statistics, the majority of candidates have at least had 1 or 2 jabs of the vaccines. As said by Mrs. Hong and also the Secretary, for those who are subject to compulsory quarantine and for confirmed candidates, if they still wish to take the exam, then they can do so at Penny's Bay Community Isolation Facilities. Together with our enhanced measures, I'm sure we can safeguard the health and well-being of candidates and exam staff. The exam will commence very soon. Starting from the 7th of April, we will hand out the admission cards. They will be distributed through schools, and for the self-declared candidates, they will be receiving it by post. RATs will be distributed through schools together with admission cards. And for the self-declared students, then they can go to our Sampo Kong office or Chunwan office. Starting from the middle of April, they can get their admission cards as well as RAT kits. Now, I ask candidates to keep their RAT kits properly, because there can be no replacement for any kits lost. And as said by Mrs. Hong, during the DSE, a candidate confirmed with COVID or under quarantine cannot attend an exam venue, but then they can ask to take the exam at Penny's Bay. There are 2 types of candidates that can take the exam at PBCIF. First, those tested positive by RAT or PCR. Well, if a candidate tests positive on the day of the exam, then he can apply for sitting for the exam at PBCIF, but they need to apply for an isolation order from the government first. And the second type are candidates who are close contacts of confirmed cases. Perhaps their family members are confirmed. Again, they can make use of the similar declaration system. They need to acquire a quarantine order first before they can opt for taking the exam at PBCIF. Of course, there may be candidates who are only confirmed on the day of the morning of the exam, or who are required to be quarantined. Will allow them to take the exam first and do the declaration afterwards, because this is most important. Only the government can certify that they are either confirmed or under quarantine. candidates are confirmed or close contacts will have to approach the HKDSE as soon as possible to make a health declaration and to state their wish to attend the exam at PBCIF. They also have to call a government hotline to arrange for transport. They have to state that they are candidates of HKDSE and they have to attend the exam at PBCIF, and point-to-point transport will be arranged for them. If the candidate is only confirmed or become a close contact on the day of the exam, he has to approach our information center of HKDSE before 6:30 a.m. to make arrangement for him to arrive at PBCIF on time. Now, as said by Mrs. Hong, this point-to-point transport is only one way. So other candidates should not abuse the hotline because there can be no return trip from PBCIF. And candidates that have an exam on that day will have priority in using that hotline. If you are not attending an exam on that particular day, please do not call the hotline. And this is a triage arrangement, so keep calm. And resources at PBCIF are limited. We cannot tell how many candidates will be sitting for exam there. So for family members of candidates, they may be confirmed cases or close contacts. They cannot use the same transport to go to PBCIF. They will have to be isolated or quarantined in some other facilities. Now, there are procedures to go through and special traffic arrangement for attending PBCIF, and if there is some minor delay or hiccup, then we can delay the start of the exam a little bit. Now, if candidates would like to take the exam at PBCIF, they will be separated into different regions. Candidates confirmed will be in one area, and candidates under quarantine will be in another area. There are site constraints at PBCIF. After all, it is an isolation facility, not a school, so there may not be facilities for students with special education needs. I am sorry that there can be no special arrangement for SEN candidates. We hope that confirmed candidates can also take part in the examination, but we ask parents and also students that are confirmed to think twice. While you can still sit for the exam at PBCIF, if you don't feel well, please do not take the risk. Because once you have opted for taking the exam at PBCIF, there can be no reversing the decision. So if you don't feel well, perhaps performance will not be up to your expectation. If a candidate confirmed is not fit for the exam or is not willing to take the exam at PBCIF, can opt for an assessment. Now, assuming that a candidate has already taken paper 1 of several papers, so the candidate can still apply for an assessment to HKDSE. So the result of performance in one paper of a subject can be used for an assessment to get a grade for the whole subject. And same As the previous year, we have already adjusted the maximum grade that can be awarded in a particular subject to level 5. For private candidates, I'm afraid they cannot entitled to this arrangement. The HKDSE will recruit examination staff. I hope that all those who are eligible, that is, if you have a degree or you have experience in teaching or in invigilation, you can apply for those jobs to be our invigilators.
We would also walk through schools and other school bodies to make the appeal. So those who are qualified and who have been quarantined or have been infected and recovered, these are most welcome. Now, taking reference from the experience last year, the HKDSE will provide PPE to all the exam staff and also offer training to safeguard their safety. Exam staff will be divided into different groups to invigilate at different zones. Every candidate will take the exam in an independent unit in Penny's Bay, and a monitoring system will be installed in every unit. So the invigilators can monitor the exam through a computer system in a certain room. So this arrangement is to minimize the contact between the candidates and invigilators. HKDSE like to remind candidates that you should take temperature before you go for exam, and you should also do an RAT, and also fill up the health declaration form duly. And because of the frequent updating of government regulations, the health declaration form may be revised from time to time. So please watch out for the latest development. And candidates should keep the negative RAT results and take a photo of the result together with the exam admission forms. And the information should be kept until after the exam for checking by us. We will continue to work closely with the EDB, public health experts, and will monitor closely the developments of the epidemic. And if further adjustment is needed, an announcement will be made in the first instance. I would like to thank the EDB and other government departments for assisting us in our work. We look forward to candidates' cooperation and understanding of these changes in the exam arrangements. I hope that they can focus on their study and excel in their exam. And I hope that this year's DSE will also be exam without any infection. So this is a Q&A session. Please identify your organization. Please be succinct in your questions. I'm from Mingpao. Arrangement on the special exam centers. You don't have any numbers now. How many places do you have? Do you have to reserve a certain number of anti-epidemic taxis for use? And for the candidates, well, how can they judge whether they are fit for taking the exam? Do healthcare staff have to do a simple checkup on them? And for the invigilators, what is the number that you are aiming at? Are you worried that you will not be able to get enough invigilators, and as a result, you have to recruit certain teachers to do the work? Now, before the exam, there are intervening holidays like Qingming Festival, Easter holidays, and people are worried that there may be a rebound of the infections. So, is it possible that you might have to change the date of the DSE because of a rebound in the epidemic situation? We just said that recently there has been we are seeing that the epidemic is easing a bit. But then we need the whole society to observe strictly the anti-epidemic measures, including social distancing rules. And we appeal to the public to refrain from group gatherings in the upcoming holidays. Only by doing that, we will be able to continue to see a downward trend in the pandemic. For now, we are confident that we can start the exam on the 21st of April. Meanwhile, we will also keep close tabs on the situation. In the event that something unforeseen is happening and changes are warranted, then we will make an announcement instantly. But for now, we are still confident that the exam can start on the 21st of April as scheduled. I hope that the whole society can work together with us on this. Like what Mrs. Hong said, in terms of the special exam venues, for certain students, one of the difficulties is that it's hard to estimate the number of students who need to go to these exam venues. How many will be close contacts, how many confirmed cases. At Penny's Bay now, there are some 3,000 units. We have done some sums, so 1,000 or so students can be placed there. But we will keep monitoring the development of the pandemic. And if needed, we have some other sites which can serve as a backup. But for now, we think that there should be sufficient facilities in there. The two other speakers have also made an appeal asking those who are qualified to be invigilators or exam staff to come forth to take up the work. And in the recent past, many in the school sector have called for a special exam center to be set up for DSE students. So I am confident that people will come forth to serve as exam staff. As to how the candidates can decide whether they are fit for taking the exam, well, we are talking about the close contacts and confirmed cases. They know their own health condition best. Now, if you are a confirmed case, you carry the virus and you may feel uncomfortable. But as to how uncomfortable they feel, well, the confirmed cases know best. So the candidates must think this through carefully. They must assess whether they are in the best condition to take the exam. If they take the exam while they are feeling very tired and feel lethargic and so on, then that may not be the best scenario. All we are doing is we provide another option for them. If the student is confirmed, it may be best for him or her to take more rest. But then we see that as some confirmed cases have mild symptoms, so they may like to take the exam, so we are providing this option to them. The lady at the back, I'm from Now TV first. About the special exam venues. So you said every day a total of 1,000 students can take the exam there. Is that right? You can't estimate the number of students, but how many units can be converted as an exam unit at Penny's Bay? Do you have a figure for that? Now, students may be quarantined in Penny's Bay, and then they can decide on the exam day on whether to take the exam. So how can you make the arrangements for exam papers and invigilators and so on? How can you ensure that there are sufficient number of exam papers for those who opt to take the exam on the exam day? And then you say that they should call before 6:30 a.m. for arranging an anti-epidemic taxi. So does it mean that if they call before 8:30, then the taxi will not be arranged for them? So if they arrive late, does it mean that they can't take the exam at all?
And the secretary said that hopefully this can set the minds of candidates at ease. In fact, the exam will commence on the 22nd of April, and these arrangements are only announced 2 weeks or so before the exam. Do you think that your announcement can really set their minds at ease? Some candidates have been saying online that they would rather get COVID earlier because they feel rather uneasy. So you only make announcements 2 weeks or so before the exam. Do you think that can really relieve them? And then will you require them to send you images of their RAT negative result to you, or would they just be required to fill in a health declaration? Professor Why we talked about the RAT test, and Mrs. Hong can also supplement later. You asked whether our announcement can set the minds of candidates at ease. As asked by a reporter whether we're going to change the arrangements again. Now, this is the state of the epidemic. In early February, we already said that in the coming few months, we have already plans for different scenarios. Of course, we have to keep in view the trend of epidemic. When the number of confirmed cases were over 10,000, would we be confident to say that the exam can go ahead? Now, today, we're very confident, judging from the figures in the past few days. But then we still have to keep track of the figures in the coming few days. But candidates can rest assured we care for them. We closely monitor the development of the epidemic. We are doing our utmost to ensure that our examination venues are safe. We put in place all precautionary measures. Every morning, candidates are required to do an RAT. Hopefully, the majority of our candidates can sit for the exam in a safe environment. And we've also told you the arrangements of the special exam site. Of course, the time to call, well, there may still be changes. Now, assuming that a student did not wake up in time, and he only does an RAT at 7 something and tests positive, can we for sure say that we can provide for him? Now, we have a special education exam venue. We have no idea where the candidates requiring the venue to be living. They may be in different districts of town. So we have different plans to cater for different scenarios. So if they can call us before 6:30 a.m., we are confident that we can help. But for sure, can we say for sure that we cannot help those who call later than 6:30? I can give no guarantee, but we will do our very best. So we are giving another option for candidates. In fact, for candidates' point of view, now that they are informed of our arrangements, they should stay focused in the exam preparation, and then they should keep themselves healthy. Mrs. Hong, PP Penis Bay was used for candidates who were close contacts but not confirmed. The PBCIF is a very valuable resource. In principle, the whole PBCIF is reserved for candidates, but we don't rule the possibility that people in society need the place for quarantine or isolation. For instance, if there are children staying there, we cannot evacuate them. The elderly persons, we cannot evacuate them. And there are units that have to be repaired. You might have heard of stories where disgruntled persons damaged or sabotaged the units, and so they have to be repaired. And candidates may have onset of the disease at different times, and the duration of the exams may also be different. For instance, for private candidates, on average, they only take 3 subjects. So, given the downward trend of the epidemic now, is all about a probability. We believe we have 1,000 or so places. I think that should be sufficient. We're not saying that we have 1,000 every day. Now, because if there is about 200 admissions per day, then because the effect is cumulative. But we cannot say for sure. We do not have a crystal ball. So we have some backup. We have a backup examination site. Now, if the spillover is a little bit, then we may be able to cover. We may be able to have a few more sites. Now, for some of the facilities, they may have to use a communal bathroom. Now, and such that a candidate will live on an upper story and they take the exam on a lower story. So we can only make available PBCIF if the epidemic continues to decline. Well, I am prudently optimistic given the current trend, but no one has a crystal ball. Now, when the epidemic is very rampant, then I cannot be 100%. It's not that we are careless to the needs of our candidates, but we must give priority to those who are in poor health, who require isolation facilities more urgently. It's because the epidemic has eased that we have more places at PBCIF that we can use the facilities, and whether students can be relieved. I think this is a test for them in life. This morning I received this message. We should not regret about the past because that is too negative. We don't have to worry about the future, which is yet unknown. The best thing is to grasp the present and cherish the present moment. Now, we have a special arrangement for candidates. They have an option. They don't have to worry. For the future, all they have to do is to stay focused and make preparation for the exam. The question was whether we could make timely preparations. That's why we want them to inform us by 6:30 a.m. They have to be rushed to the venue, and we also have to make arrangements because our exam papers cannot be stored there. We have to know the exact number of candidates, and then send the exact number of papers there, and we have invigilators to stand by, and they have to take transport to arrive at the venue. So I hope you understand why they should inform us by 6:30 a.m. of the day. Now, whether an R18 negative result has to be photographed. Yes, we need an image of both a positive RAT result and a negative RAT result. It should be attached to the admission form, and the time should also be indicated. That is for our checking afterwards. We don't want irresponsible candidates making a false declaration to affect the safety of a venue. So we will check.
Next question, the lady at the front. From TVB, 3 questions. First, about the special exam venue. If the candidate confirmed, how long can he stay? If there are 3 papers, does it mean that he or she takes that 3 papers and he or she can continue to stay? So how long can he or she stay there? And for RAT test, would you be worried that the candidate will use some other papers' test results? And then if at the exam venue you spot some candidates who keeps coughing and shows serious symptoms, would you be asking the candidate to do another PCR or RAT test? And then you said that it's best if the candidate can notify you before 6:30 a.m. How many lines are there in the hotline? Is it operating 24 hours a day? Are you worried that the candidates cannot get through? And then for anti-epidemic taxis, well, the taxis may not be hailed conveniently. So if we don't use the taxis, can we drive to Penny's Bay? And if they arrive at the venue late, what will be the consequences? For RAT, I'll defer to Professor Wei to respond. And then for anti-epidemic taxi, I'll defer to Mrs. Hong. For the special exam venue, it is actually an isolation center. So the confirmed case or close contact has to meet with certain requirements before he can be released from the isolation center. So all the conditions in the relevant orders have to be fulfilled. So the candidate is going into the isolation center, not just for the exam, but also for isolation and quarantine. It's just that you can also take the exam there. So after the exam, he or she should stay there before the order is released. The secretary said very clearly, we're not going to say a holiday camp per se. So what it means in effect is you opt to be isolated or quarantined in that center. So the candidate should register on the CHP website. If you test positive on the exam day, you may take a taxi to the Penny's Bay community isolation facility, but then you still have to report and do the declaration online on the same day. And that facility serves as the exam venue. So the candidate has to meet with the relevant requirements. If you have taken 2 jabs, and you should take a test on the 6th and 7th day, and if you test negative, then you can leave. But if you have not been vaccinated, the period is 14 days. So that's the requirement of the CHP. Now, as for the hotline, well, you can start calling the hotline at 6. But there is limitation to the capacity of the hotline. If you call in, they will tell you which place you are on the queue. Hopefully, the taxi can be held within a short time. But after all, we're talking about 18 districts in Hong Kong. So we have to strike a balance. We put candidates' interests first, and we try to rationalize things. Normally, if you arrive late at the exam venue, you have to stop at the same time as the others. But then Penny's Bay is quite far away, and so we think in some circumstances we can allow leeway. Sometimes it may not be that the candidate has waken up late. We don't want to see a delay on the part of the candidates arriving at the venue, and we hope that we can meet the 8:30 exam time. And if they arrive a little bit late, then they can finish later. Now, whether you can drive to the Penny's Bay, no. You have to register first before you can drive there. Now, as for the test, like I said, we hope that the candidates have civic responsibility. They should report their situation truthfully. If you present false results, you are affecting not only yourselves, but your classmates and teachers and so on. Even if you test positive, you can still take the exam at Penny's Bay. So please bear in mind the over-interest of other people. If we find that you are making false declaration, the highest penalty is that you will be disqualified for the exam. So refrain from doing that. Mrs. Hong also said we would exercise discretion. We know that special arrangement has to be in place to take the candidates to the Penny's Bay. Anti-epidemic taxis will be deployed. Candidates may arrive a bit late. Well, we will be mindful about the hour that you are calling the hotline. If you call the hotline too late, then we may not be accommodating. But then if you call before 6:30 a.m., then we will be more accommodating. Well, the way that we're doing it is to postpone the commencement time of the exam. Well, we will be looking at the actual circumstances, but then the commencement time should not be too late. If it is too late, then while others have completed the exam, then they may let you know what the questions are. So we should not commence the exam time too late. Well, the one in white in the left. I'm from Economic Times. First question. For Mr. Yeung, the Secretary said that candidates' minds can be put at ease with this arrangement. Last month, the Secretary said that there was no special exam venue for candidates. But today, you said that there is this arrangement. So do you think that the way you are announcing the arrangement adds extra burden to candidates? The candidates have been worried for over a month. And today they find out that they can actually take the exam even if they are under quarantine. Now, for standby exam venues, you said that once an option has been made, then you cannot change your mind. The HKEAA is setting the maximum level of attainment at level 5. So would it mean that candidates who are feeling unwell would still like to take the exam? So why wouldn't you raising the highest level of attainment? Now, if a candidate stops taking the exam in the middle of an examination, will he be given the option of assessment? Recently, some school bodies have said that they are not happy about resuming full-day face-to-face classes only when a 90% vaccination rate is reached. 40% of the teachers in a survey do not agree to that. They think that their right to have full-day classes has been deprived of. So will the Secretary think more about this? Will the government also think about replacing vaccination requirements with the requirements to take the RAT tests?
Well, you may all recall what was it like in February and also the state of the epidemic back then. And the isolation facilities we had back then, and you would understand why we could not promise to provide an examination venue at isolation facilities for candidates. But as more isolation facilities have been built, we have the room to do so now. Of course, we have always placed the interests of students at our foremost. And the interest is not just about their taking an examination, but also their health and also the impact on the whole community. So in February, we really did not have the room and the capacity to promise that this could be done on the 22nd of April. All along, the HKEAA has got a mechanism for candidates who could not attend a meeting, an examination due to traffic problems or due to personal reasons. There is a mechanism to assess the result of candidates. Local as well as overseas universities accept this mechanism as a resolution. Now we have the capacity to provide a special exam venue. We are offering an alternative for students, but we have stressed time and again, students have to think twice. When you're not feeling well, should you sit for an examination? I think candidates should not overload their body. It may not be something desirable for their health. As for class resumption, I will not go into details today because we are still making the preparation work, and this press briefing is mainly on HKDSE, but we have heard the voice of the community. We have to consider as a whole the state of the epidemic and see how class resumption can be done in an orderly and phased manner. Perhaps you have missed what we said. Once admitted to PBCIF, a candidate can decide whether to sit for the exam on that particular day based on his own condition. So even though he is already in PBCIF, he can opt for assessment for that particular subject. So we are very lenient as for why we should cap the grade at level 5. Now, I think this is a mistake. Now, in the past, if not for COVID-19, a candidate with a medical certificate can only be awarded a level 4 result at most. But because of COVID-19, we've already raised the cap to level 5. And I think Professor Wei can explain. Level 5 is just a reference, is a level reference. And level 5 is already the maximum, because for 5 and 5-star, there is a certain percentage involved, and it's dangerous to further relax the cap. And is it fair if we further relax the cap? In our communication with the school sector, no one raised this to me or to us. Perhaps this is just a view of KOL out there, but there was no one in school council asking us to raise the level, because for a student, a candidate who has never taken part in a certain exam, if we award him with a 5-star, is that really unfair? This will be an there will be impacts on our system. Where in the past we only kept it at level 4, we've already relaxed it this time. Experts have different views. Some feel that it's not fair to raise the cap to level 5, because we believe taking an examination is a fairer mechanism. You have to have set in an exam before you should be awarded a certain level, because at level 5 you are already at the top 10% of candidates. Top 5% of the candidates. Well, even if you have set in a certain exam, there's no guarantee that you could get level 5. Even though for a candidate who has taken an exam, there is no guarantee that he can get level 5. And if we award level 5 to someone who has never taken that exam, is it fair to participating candidates? And 5-star is even, or 2 stars is even more challenging, because a candidate will have to work very hard in an examination before he can get 5 double stars. And if we award it to someone who hasn't really taken the exam, this is unfair. And some experts are saying that we should not award 5 double stars to a candidate who hasn't taken an examination at all. I'm from cable TV. For safety reasons, will you consider a closed-loop arrangement at the special exam venue? For instance, should invigilators stay in isolation facilities or quarantine hotel until the exams are over? Will a special allowance be awarded to attract people to apply for the jobs? Some political parties suggest that you can recruit confirmed cases that have recovered, or those who have taken 3 jabs, to be invigilators at the special exam venue. And are you worried that some candidates will cover the fact that they are confirmed in order to be able to take the exam? That may lead to an outbreak. You double-check the images of the RAT kids before you allow them into a venue. And as for the backup exam venue, can you tell us if PBCIF is full, what backup venues do you still have for the examination? It's a very complicated thing to have an alternative or have a special exam site at PBCIF. There are a lot of uncertainties involved, and we need the collaboration of many government departments. We must have regard for the safety and well-being of candidates and exam staff. We will ensure sufficient facilities to ensure the well-being of candidates and exam staff. So the arrangements at the special exam venue, Mrs. Hong can supplement, and then Professor Wei can talk about ordinary exam venues. We have chosen PBCIF because even for people working there, they are not under a closed-loop management. They wear PPE to work, and they go through disinfection after work. There is no need for closed-loop management, and so that applies to the invigilators there. Last year, we also recruit exam staff. They are given an honorarium, but it's just a nominal basis. I think they have a special allowance. We are inclined to appeal to recovered COVID patients who are qualified to volunteer to serve here. We have yet to know the pool available. We want them to apply for the job, but they have yet to come forward. We encourage more to apply before we can have a larger pool to select from. And if we pass certain categories, then we may not have enough candidates to apply for the job. Well, last year, there were invigilators. They did not serve for the sake of money. They had serving spirit. And as said by the secretary, there are civic-minded persons who care for our students. I hope they will still have community-spirited persons to come and serve.
Well, a lot of people who serve because they care about our students. So we are appealing for them to help. Now, when it comes to the school exam center, will we check the RAT results? Well, there will be a lot of candidates flooding in the exam center at the same time, so it might not be practicable to check the result of everyone. All we're asking is for them to keep the records, and we may do spot checks in the future. And what we also ask them to make a declaration on a health declaration form, and we trust in them. The last one, the lady here at the back. I'm from Hong Kong 01. I have one question. If a candidate finds out that he or she is confirmed after taking the exam, does he or she have to report to the HKDSE? Will the students in the same venue be notified? Do they have to be put under compulsory quarantine? Well, this is a very good question. This is what happened last year. Some candidates were found to be close contacts, and the entire exam center had to be closed down. Candidates, whenever they find out that they test positive, they should notify us, the relevant government departments. They have to be isolated at home or isolated at other facilities. All these have to be undertaken. Now, how will the exam center be affected? We have asked the health experts. We are enhancing our precautionary measures. If there is good ventilation in the exam center and everybody wears a mask, everyone is sitting far apart, and there will not be a lot of exchanges during the breaks, then generally speaking, those in the exam venue will not be considered as close contacts and be put in isolation or quarantine. But then health experts have to assess each individual case. Say if in one exam center, a lot of students or candidates are being infected, then health experts have to look into the causes, and the exam center has to be closed down. But if we're talking just about one or two cases, the schools do not have to be closed down. Of course, the thorough cleansing has to be undertaken at the school as well. And those in the same exam center are not listed as close contacts. So that's it for the press conference. Do you have a handout for them?